What are the key elements involved in managing the operations of a veterinary practice, and how can a practice improve its operational efficiency? Answer: managing the operations of a veterinary practice involves several key elements such as patient care, client service, financial management, human resources, inventory management, and legal compliance. To improve operational efficiency, veterinary practices can implement lean management principles, streamlining processes to reduce waste, such as optimizing appointment scheduling to minimize downtime between patient visits, effective staff management, ensuring proper delegation, role clarity, and continuous staff training so each team member understands their responsibilities and the practice runs smoothly. Automating administrative tasks, using veterinary practice management software to automate client communications, reminders, and billing to reduce administrative workload, regular financial reviews, monitoring cash flow, expenses, and revenue to identify areas where the practice can cut costs without compromising quality of care. By aligning operations with best practices, veterinary practices can ensure efficiency, reduce errors, and improve client satisfaction. How should a veterinary practice handle inventory control to ensure that it meets client needs while minimizing costs and waste? Answer: effective inventory control is crucial to meet client needs without excessive stockpiling or waste. The steps to ensure efficient inventory management include inventory tracking systems. Utilize software tools to track inventory levels in real time and generate automatic alerts when stock levels are low. Establishing reordering protocols. Setting par levels for products and services ensures that critical items are reordered before running out and that overstocking is avoided. Regular audits and stock rotation. Implement periodic physical audits to verify stock accuracy and rotate perishable items to prevent expiration. Supplier relationships. Establish strong relationships with reliable suppliers for prompt delivery, favorable pricing, and to ensure timely access to essential items. According to health and safety regulations, e.g. Regulation 36 of the Health and Safety at Work Act 1974, safe storage and proper handling of medications and medical equipment must be followed to prevent harm to both employees and clients. Mr. Smith, a veterinary nurse, notices that the clinic's pet sedation protocol for surgical procedures is not being followed consistently by junior nurses. What actions should Mr. Smith take to address this issue, ensuring both the safety of patients and the regulatory compliance of the practice? Answer: Mr. Smith should take the following steps. Immediate assessment. Mr. Smith should first ensure that any immediate concerns regarding patient safety are addressed. If any sedations have been improperly administered, he must inform the supervising veterinarian immediately. Review and reinforce protocols. Mr. Smith should schedule a meeting with the junior nurses to discuss the clinic's sedation protocols, ensuring they understand the rationale behind the guidelines and the risks of non-compliance. Ongoing education. Mr. Smith should provide additional training or refresher courses on the sedation protocols, emphasizing the correct procedures and the importance of adhering to them. Supervision and mentorship. He should offer closer supervision to the junior nurses until they demonstrate competence in following the sedation procedures. Documentation and reporting. Any issues identified should be documented, and the clinic's policies on continuous monitoring should be revisited to ensure patient safety. Regulatory considerations. If the issue persists, it is essential to consult relevant guidelines, such as those from the Royal College of Veterinary Surgeons or EVS, which emphasize ethical and professional conduct in veterinary practice. What financial management strategies should a veterinary practice adopt to remain financially viable while offering affordable services to clients? Answer: financial management in a veterinary practice is critical for balancing profitability with client affordability. The strategies include cost control and budgeting. Establish clear budgeting processes to track income and expenses, ensuring that costs are aligned with practice income. Service pricing strategy. Develop a tiered pricing structure that allows for flexibility based on the service provided while ensuring that the prices cover both direct and indirect costs. Insurance and payment plans. Offer payment options such as installment plans or pet insurance assistance to make services more accessible while maintaining cash flow. Financial forecasting. Regularly project income and expenses for the next fiscal year, adjusting for seasonal trends in animal care needs according to veterinary business management guidelines by the RCVS. Transparent financial practices, including clear communication about costs with clients, are essential for maintaining trust and ensuring financial stability. Ms. Harris, a registered veterinary nurse, attends a seminar on new evidence-based approaches to managing canine arthritis. How can Ms. Harris integrate this new knowledge into her practice and improve patient outcomes for clients with dogs suffering from arthritis? Answer: MS. Harris should take the following steps to integrate evidence-based approaches into her practice. Assessment and reflection. She should review the current practices used at her clinic for managing canine arthritis and identify any gaps or areas for improvement. Collaboration with the veterinary team. After attending the seminar, MS. Harris should share the new evidence-based knowledge with her colleagues, particularly the veterinarians, and discuss how these approaches can be incorporated into treatment protocols. Client education. MS. Harris can create client education materials or host informational sessions to ensure dog owners are informed about the latest treatment options for arthritis. Patient follow-ups. She should monitor patient outcomes such as pain levels and mobility improvements and document the effectiveness of the new treatments. Continuing professional development. MS. Harris should continue attending relevant seminars, workshops, and conferences to keep up with the latest veterinary trends in pain management and arthritis care. Explain the importance of maintaining professional certifications and licenses for a veterinary nurse and what actions should be taken if a certification or license is close to expiration. Answer: maintaining professional certifications and licenses is crucial for ensuring that veterinary nurses are legally allowed to practice and are up to date with the latest developments in the field. The actions to take include monitoring expiry dates. Veterinary nurses should regularly check the expiry dates of their certifications and licenses. Continuing education, complete required continuing professional development (CPD) credits, including attending accredited courses, workshops, and online learning. Renewal applications. Submit applications for renewal well in advance of the expiry date to avoid lapsing. This often involves submitting proof of completed CPD and any additional required documentation. Compliance with regulatory bodies. Veterinary nurses must ensure they comply with regulations set forth by governing bodies such as the Royal College of Veterinary Surgeons (REVS), which mandates that practitioners keep up to date with changes in veterinary practice. How does risk management and insurance contribute to the sustainability of a veterinary practice? Answer: risk management and insurance are essential for the long-term sustainability of a veterinary practice by mitigating financial and operational risks. The key elements include identifying potential risks. This involves assessing operational risks, such as employee errors, malpractice claims, equipment failure, and natural disasters. Implementing risk mitigation strategies. Practices can implement policies such as patient consent forms, staff training on handling dangerous animals, and proper storage of medications to reduce risks. Adequate insurance coverage. Veterinary practices should have comprehensive insurance, including professional liability, property insurance, and business interruption insurance to cover unexpected events. Risk reviews. Regular reviews of risk management strategies and insurance policies are necessary to ensure the practice remains protected against emerging risks. Following Health and Safety at Work Act 1974 and professional indemnity insurance guidelines can ensure a veterinary practice minimizes liability and remains operational in case of unforeseen events. Why is it important for veterinary nurses to engage in lifelong learning, and how can this affect the care provided to animals in their practice? Answer: lifelong learning is critical for veterinary nurses to stay current with evolving technologies, techniques, and medical knowledge. The benefits include improved patient care. By staying informed about new medical advancements, veterinary nurses can offer the most effective treatments and prevent the use of outdated procedures. Personal professional growth. Continuing education helps veterinary nurses develop new skills, allowing them to take on advanced roles and responsibilities within the clinic. Enhancing client relationships. Clients are more likely to trust veterinary professionals who demonstrate a commitment to continuous learning, as it showcases a dedication to providing high-quality care. The RCVS Code of Professional Conduct emphasizes the importance of ongoing professional development to maintain competence and provide high standards of care. What are the ethical implications of a veterinary nurse managing financial matters such as billing and payments for services rendered? Answer: the ethical implications of managing financial matters in a veterinary practice involve transparency. Veterinary nurses must ensure clients are fully informed of the costs of treatments before services are rendered, following the ethical principles of honesty and integrity. Avoiding conflicts of interest. Veterinary nurses should not engage in financial practices that could create conflicts of interest or give the appearance of impropriety, such as accepting kickbacks from suppliers. Confidentiality. Patient financial records must be kept confidential in accordance with data protection laws such as the General Data Protection Regulation (GDPR). Fair billing practices. It is essential to apply billing protocols consistently and equitably, ensuring that clients are charged fairly for services. The RCVS Code of Professional Conduct requires veterinary professionals to uphold ethical standards in all aspects of practice, including financial management. Mrs. Daniels, a longtime client, expresses dissatisfaction with the cost of a recent procedure for her cat. She feels the clinic's fees are too high compared to other local practices. How should the veterinary nurse handle this situation to maintain a good client relationship? Answer: the veterinary nurse should take the following steps. Acknowledge the client's concern. Show empathy for Mrs. Daniels' situation and acknowledge her concerns regarding the cost of the procedure. Explain the costs transparently. The nurse should provide a clear breakdown of the costs involved in the procedure, explaining any additional services or specialized care that may have contributed to the price. Offer payment solutions. If applicable, suggest payment options, such as payment plans or pet insurance, to ease the financial burden. Review the clinic's pricing structure. Offer to review the pricing with the practice manager or vet to ensure competitive and fair pricing in the area. Follow-up. After the conversation, the nurse should follow up with Mrs. Daniels to ensure satisfaction and offer additional support for her pet's ongoing care. According to RCVS guidelines, maintaining transparency, empathy, and a commitment to patient welfare are essential to good client relationships. Explain the principle of balanced anesthesia and its significance in veterinary practice. How does it contribute to reducing the risk of complications during surgery? Answer: balanced anesthesia is a technique where multiple anesthetic agents are used in combination to achieve the desired anesthetic effect while minimizing the side effects associated with each individual agent. This approach typically combines an intravenous induction agent, e.g., propofol or alfaxolone, inhalational agents, e.g., isoflurane or sevoflurane, analgesics, e.g., opioids like morphine or fentanyl, and muscle relaxants, e.g., rocuronium. The rationale is to use the lowest possible dose of each drug to minimize the risk of side effects such as hypotension, hyperventilation, or cardiac arrhythmias. Balanced anesthesia improves the overall safety of the patient by addressing various components of the anesthetic process, including induction, maintenance, analgesia, and muscle relaxation. In veterinary practice, it is critical to adjust the agent combination according to the species, age, and health status of the animal. Describe the key components of a preoperative assessment for an animal scheduled for surgery. Why is each component important in ensuring the safety of the procedure? Answer: a comprehensive preoperative assessment involves the following components: medical history. A thorough review of the animal's medical history, including any past surgeries, allergies, or ongoing medical conditions, e.g. diabetes, heart disease. Physical examination. Assessing vital signs, e.g. heart rate, respiratory rate, blood pressure, and checking for any physical abnormalities such as abnormal heart sounds or respiratory distress. Laboratory tests. Blood work, including CBC, liver and kidney function tests, and electrolyte levels to detect any underlying conditions that may affect anesthesia or surgery. Pre-anesthetic medications. Administering sedatives, analgesics, or anticholinergics to minimize stress and manage pain. Assessment of anesthesia risk. Categorizing the animal based on ASA, American Society of Anesthesiologists, risk classes helps guide the level of monitoring required. Each of these components helps reduce the risk of complications during anesthesia and surgery. It ensures that any pre-existing conditions are managed appropriately and that the anesthetic plan is tailored to the individual animal's needs. A veterinary nurse is tasked with preparing instruments for a soft tissue surgery. Which key instruments would be needed, and what is their specific function in the procedure? Answer: for a soft tissue surgery, common instruments include scalpel, used for making precise incisions in the skin and other tissues, scissors, Metzenbaum or Mayo. These are used to dissect delicate tissues or cut through fascia and muscle. Forceps, Atzen or DeBakey, used to hold tissues gently without causing trauma, essential for manipulating delicate tissues during surgery. Needle holders, Mayo Heger or Olsen Heger, used to grasp and manipulate suturing needles during the closure of incisions. Hemostats, Mosquito, Kelly, used to clamp blood vessels or tissues to stop bleeding. Surgical drapes and sterile covers, essential for creating and maintaining a sterile field. Each of these instruments plays a specific role in ensuring a sterile and efficient surgical procedure while minimizing the risk of complications such as tissue damage or infection. Explain the importance of continuous monitoring during anesthesia in veterinary surgery. What parameters should be monitored and why are they critical to patient safety? Answer: continuous monitoring during anesthesia is essential for detecting and responding to any potential complications in real time. The following parameters should be monitored: heart rate and rhythm. Changes in heart rate or rhythm can indicate anesthesia depth. blood loss or cardiovascular instability, respiratory rate and tidal monitoring the animal's breathing helps ensure adequate ventilation and gas exchange. Blood pressure, low blood pressure, hypotension can reduce perfusion to vital organs, potentially leading to organ failure. Oxygen saturation, SPO, ensures that the animal is receiving adequate oxygenation during anesthesia. Body temperature, hypothermia can occur during surgery, and adequate temperature regulation is necessary to avoid complications like cardiac arrhythmias or delayed recovery. Continuously, CG monitoring allows for the early detection of arrhythmias which may require intervention. Monitoring these parameters ensures that the animal is stable throughout the procedure and allows for prompt action if abnormalities arise. Mr. Miller has brought his cat, Felix, into your clinic for a routine spay. After surgery, Felix is not waking up as expected from anesthesia. What immediate actions should you take to address this situation? Answer: if Felix is not waking up as expected from anesthesia, immediate actions should include: check vital signs. Ensure that Felix has adequate breathing, heart rate, and blood pressure. If breathing is shallow or absent, assist ventilation with an oxygen mask or intubation if necessary. Reassess anesthetic depth. Verify that the animal has not been overdosed on anesthetic agents. If necessary, reverse any injectable agents, e.g. naloxone for opioids. Hypothermia. Check for signs of hypothermia, as anesthesia can reduce the animal's ability to regulate temperature. Warm the animal using heating pads or other methods to raise body temperature. Pain management. Ensure that Felix is receiving adequate analgesia, as inadequate pain control can delay recovery and cause distress. Administer appropriate analgesics as needed. Monitor recovery. Continue to monitor respiratory rate, heart rate, and other vital signs closely during the recovery period to ensure stabilization. In this case, close monitoring and prompt intervention can prevent complications and ensure a safe recovery. Describe the types of analgesics commonly used in veterinary anesthesia and their mechanisms of action. Why is it important to tailor analgesia to the individual patient? Answer: common analgesics in veterinary anesthesia include opioids, e.g. morphine, fentanyl, act by binding to opioid receptors in the brain and spinal cord, reducing the perception of pain. Opioids are powerful analgesics but can cause side effects like respiratory depression and sedation. NSAIDs, e.g. meloxicam, carprofen, work by inhibiting the enzyme cyclooxygenase, COX, reducing the production of prostaglandins that mediate inflammation and pain. Local anesthetics, e.g. lidocaine, bupivacaine, block nerve transmission by inhibiting sodium channels, providing localized pain relief without affecting the entire body. Alpha-2 agonists, e.g. dexmedetomidine, inhibit norepinephrine release, leading to analgesia and sedation. It is essential to tailor analgesia to the individual patient to maximize efficacy while minimizing side effects. Factors such as species, breed, age, health status, and the nature of the procedure should guide the choice of analgesic. Explain the stages of wound healing and the role of a veterinary nurse in promoting optimal healing in surgical wounds. Answer: wound healing occurs in three main stages. Inflammatory phase. Immediately after injury, the body forms a clot and inflammatory cells clean the wound. The veterinary nurse's role includes cleaning the wound and applying appropriate dressings to prevent infection. Proliferative phase. New tissue and blood vessels form to close the wound. A veterinary nurse can assist by monitoring the wound for signs of infection and ensuring that dressing changes are done regularly. Maturation phase. Collagen remodeling strengthens the wound, which can take weeks to months. The nurse ensures that the wound remains clean, dry, and protected to prevent re-injury or infection. The nurse plays a key role in post-operative care, ensuring wound cleanliness, managing dressings, and observing for complications such as infection or dehiscence. What are the key considerations for post-operative care in a patient undergoing soft tissue surgery, and why are they important? Answer: key considerations for post-operative care include pain management, administering appropriate analgesics, e.g. opioids or NSAIDs, to prevent discomfort and promote recovery. Wound care, ensuring that the surgical site remains clean and dry and changing dressings as needed to prevent infection. Activity restriction, preventing excessive movement that could disrupt the healing process, including limiting exercise and using an Elizabethan collar to prevent licking. Hydration and nutrition, ensuring that the patient is hydrated and, once awake, offering small amounts of food to encourage recovery. Post-operative care is critical to minimize complications, ensure a smooth recovery, and promote healing. How can a veterinary nurse assess pain in an animal that cannot verbally communicate? What are the most reliable indicators of pain in animals? Answer: in animals that cannot verbally communicate, pain is assessed through behavioral and physiological indicators. Behavioral signs: changes in activity level, posture, and behaviors such as vocalization, aggression, restlessness, or hiding. Physical signs: increased heart rate, respiratory rate, and blood pressure, hypoventilation, or changes in body temperature can also be indicators. Facial expression: in some species, facial grimacing or changes in expression can be an indicator of pain. Guarding: animals may protect the painful area, avoiding movement or touch, licking or chewing. Constant licking or chewing at the site can indicate discomfort or pain. Pain assessment tools such as the Glasgow Composite Pain Scale can be used to quantify the level of pain based on specific behaviors and physiological signs. A surgical patient shows signs of post-operative hemorrhage with increased swelling around the surgical site and a drop in blood pressure. What should the veterinary nurse do in this situation? Answer: if a patient shows signs of hemorrhage, immediate steps include pressure application. Apply gentle but firm pressure to the surgical site to help control bleeding. Monitor vital signs. Continuously monitor heart rate, blood pressure, and respiratory rate. A drop in blood pressure may indicate significant blood loss. Notify the veterinarian. Alert the veterinarian immediately to assess the need for surgical revision or additional hemostatic interventions. Administer fluids. If blood loss is significant, the patient may require intravenous fluids or blood transfusions to restore blood volume and maintain perfusion. Assess the wound. Check for the source of bleeding and, if necessary, apply additional hemostatic agents or sutures to control the hemorrhage. By acting quickly, the veterinary nurse can help stabilize the patient and prevent further complications. You are treating a trauma patient in the emergency room. The patient has sustained multiple injuries, including a suspected pelvic fracture and signs of internal bleeding. What is the primary objective in initial trauma management, and how would you proceed to stabilize the patient based on emergency protocols? Answer: the primary objective in managing trauma patients is to perform a rapid assessment and address life-threatening conditions immediately. The ABCD protocol is the standard for trauma management, which stands for airway. Ensure the airway is patterned and clear of obstruction. B. Breathing. Assess respiratory rate and oxygenation. C. Circulation. Control any bleeding and assess for shock. D. Disability. Conduct a neurological examination for signs of head injury or spinal trauma. E. Exposure. Completely expose the patient to assess for hidden injuries, ensuring thermal regulation. In this case, after securing the airway and supporting breathing, the focus would shift to controlling any external bleeding and stabilizing circulation, potentially using intravenous fluids to manage shock. Pelvic fractures are stabilized by immobilizing the pelvis to reduce internal bleeding and prevent further injury. Diagnostic imaging, e.g. radiographs or ultrasound, should be performed as soon as the patient is stable to assess the full extent of the injuries. Describe the components of a triage assessment in an emergency veterinary situation and explain how you would prioritize treatment for patients based on their condition. Answer: triage is a crucial initial step in emergency care as it helps prioritize the treatment of patients based on the severity of their conditions. The components of a triage assessment include level of consciousness, assessing if the patient is alert, responsive, or in a coma, respiratory status, checking for labored or absent breathing, heart rate and pulse quality, identifying shock or arrhythmias, temperature. Hypothermia or hypothermia may indicate underlying trauma or infection. Pain assessment, identifying patients in distress to administer pain relief. Patients should be categorized into 3 levels of urgency. Red, critical conditions that require immediate intervention, e.g. shock, severe trauma. Yellow, serious conditions that need attention but can wait a short while, e.g. moderate bleeding. Green, stable patients with non-urgent needs, e.g. minor wounds or chronic conditions. You would prioritize red patients first, ensuring that they are stabilized before moving on to yellow and green categories. In the context of electronic health records, what are the key legal and ethical considerations that a veterinary nurse should keep in mind when documenting a patient's condition and treatment? Answer: accurate and thorough documentation is critical for both clinical care and legal compliance. The key legal and ethical considerations when using electronic health records include accuracy and completeness. Every clinical decision, treatment, and observation should be documented fully and accurately. This is essential for providing continuous care and ensuring that there is a legal record of all actions taken. Confidentiality and data security. Personal data about the patient must be kept secure and only authorized personnel should have access to patient records. This is governed by the Data Protection Act 2018, which aligns with DDR. Timeliness. Records should be updated in real time to ensure the data reflects the patient's current status. Legibility. Entries must be clear and easy to understand by other veterinary professionals who may be involved in the patient's care. Failure to adhere to these principles could lead to medical errors, professional misconduct charges, or legal liability if the records are scrutinized in a court of law. Mr. Stevens brings in his dog, Daisy, a 7-year-old Labrador, who has been vomiting and has diarrhea for the past 24 hours. Daisy is lethargic and has a rapid heart rate, cold extremities, and low blood pressure. What are the steps involved in fluid therapy to address Daisy's condition, and how would you monitor her progress? Answer: Daisy is showing signs of hypovolemic shock due to fluid loss from vomiting and diarrhea. In this case, immediate fluid resuscitation is necessary to restore circulating blood volume and improve tissue perfusion. The steps for fluid therapy would include initial stabilization, administer an isotonic crystalloid solution e.g. lactated Ringer solution intravenously to rapidly restore volume. The initial bolus is typically 2030 Ag for dogs in shock. Reassessment. Monitor Daisy's response by checking vital parameters e.g. heart rate, respiratory rate, blood pressure, temperature. If shock persists, additional boluses may be needed. Ongoing maintenance. After stabilization, fluids should be administered at a maintenance rate to replace ongoing losses. Vomiting, diarrhea calculated based on Daisy's body weight and hydration status. Typical maintenance is 40 Sick day for a dog. Electrolyte balance. Given Daisy's fluid losses, consider adding electrolyte replacement solutions to address any imbalances, particularly sodium and potassium. You would monitor Daisy's progress closely through repeated assessments of hydration status, urine output, and clinical improvement over time. Mr. Thompson arrives at the clinic with his cat Tilly, who has been unresponsive and is not breathing. Mr. Thompson reports that Tilly collapsed suddenly while playing and has not regained consciousness. How should you proceed with resuscitation efforts, and what key steps must be taken to ensure a successful outcome? Answer: in this scenario, Tilly is likely in cardiac arrest, requiring immediate resuscitation. The steps for performing CPR on a cat involve initial assessment. Ensure that Tilly is not breathing and does not have a pulse. Check for signs of circulation and respiratory effort. Chest compressions. Position Tilly on her side and using both hands apply firm chest compressions at a rate of 100-120 compressions per minute. Compress the chest by approximately 1/3 of the chest width. Rescue breaths. Administer rescue breaths through Tilly's nose, ensuring that her airway is open. Give one breath every 3-5 seconds. Defibrillation. If available and appropriate for ventricular fibrillation or tachycardia use, a defibrillator to deliver shocks. Continuous monitoring. After each cycle of chest compressions and rescue breaths, reassess pulse and respiration. Continue CPR until signs of circulation or breathing return, or the patient is transferred to advanced care. The success of CPR in cats is low, but early intervention significantly improves outcomes. A dog has ingested rat poison and the owner rushes him to the clinic. What is the immediate management for poisoning in this scenario, and what protocols should be followed to assess the risk and provide treatment? Answer: in the case of suspected poisoning, the immediate management involves inducing emesis. If the ingestion occurred within the last 1-2 hours and the dog is conscious and alert, you may induce vomiting using apomorphine or hydrogen peroxide. Activated charcoal. Administer activated charcoal to absorb any remaining toxins in the gastrointestinal tract. Decontamination. In severe cases, you may need to perform gastric lavage with caution under anesthesia. Antidotes. If rat poison, e.g. anticoagulant rodenticides, is confirmed, the antidote is vitamin K. This should be administered immediately to prevent further bleeding. Monitoring. Regular blood work to assess clotting times, PT, aptin, hemoglobin levels is critical to monitor for the development of coagulopathies. Emergency poisoning protocols should always align with guidance from the Veterinary Poisons Information Service (VPIS) and the Poisoning Management Guidelines. What are the critical factors to consider when interpreting a blood gas analysis in a critically ill patient, and how would you interpret the results if the pH is 7.28, PACO is 50 G, HEO is 22 Meca? Answer: blood gas analysis is crucial for assessing the acid-base status, oxygenation, and ventilation of critically ill patients. The interpretation involves pH. The normal range, or pH, is 7.35, 7.45. Each EV 7.28 indicates acidosis. POCO, the normal POCO range is 3545 mHg. A POCO of 55 mHg suggests respiratory acidosis as it is elevated, indicating inadequate co-removal from the body e.g. due to hypoventilation. ATO, the normal range for bicarbonate is 2228 meckel. A bicarbonate level of 22 meckel is at the low end of normal, suggesting the body is compensating for respiratory acidosis by buffering excess hydrogen ions. This blood gas profile suggests primary respiratory acidosis with partial compensation by the kidneys, as evidenced by the slightly low bicarbonate. In a case of suspected sepsis in a dog, what are the key steps in initiating treatment, and what diagnostic tests would you use to confirm sepsis and guide therapy? Answer: sepsis in animals is a medical emergency requiring prompt identification and intervention. Key steps in treatment include fluid therapy. Start with IV fluids to treat shock and maintain tissue perfusion. Broad-spectrum antibiotics. Administer broad-spectrum antibiotics after obtaining samples for culture e.g. blood, urine, wound to target potential bacterial pathogens. Supportive care. Include vasopressors if required to support blood pressure and anti-inflammatory drugs to reduce the inflammatory response. Oxygen therapy. Administer oxygen to support respiratory function. Diagnostic tests. Blood cultures, CBC, complete blood count, blood lactate levels, and procalcitonin are key diagnostic tests for confirming sepsis and identifying causative pathogens. The Surviving Sepsis Campaign guidelines provide a structured approach to sepsis management. Active communication within the veterinary team is essential for patient care. What are the best practices for ensuring clear and efficient communication during an emergency procedure involving multiple team members? Answer: effective communication during an emergency procedure involves clear roles and responsibilities. Assign specific roles, e.g. one person performs chest compressions, another manages airway. Use of structured communication tools. Tools like the SBAR technique, situation, background, assessment, recommendation help organize information. Active listening. All team members should listen actively, ensuring that critical information is not overlooked. Regular updates. Provide ongoing updates on the patient's status, especially when changes occur. Debriefing. After the procedure, a team debrief ensures that any issues are addressed and performance is evaluated for improvement. When managing a dog with severe head trauma, what are the steps you should take to minimize the risk of secondary brain injury, and why is this management important? Answer: secondary brain injury can exacerbate the effects of primary head trauma. Key management steps include maintain oxygenation, ensure adequate oxygenation to avoid hypoxia, which can worsen brain injury, control blood pressure, aim for normotension to maintain cerebral perfusion pressure (CPP), minimize intracranial pressure, avoid hypoventilation, which can increase CO levels and worsen ICP, elevate the head of the patient to third to assist venous return from the brain, manage seizures, administer anticonvulsants if seizures occur to prevent further neuronal damage, monitor neurologic status. Regular neurological checks help assess the progression of brain injury and guide interventions. The Brain Trauma Foundation guidelines provide detailed recommendations for managing traumatic brain injury in veterinary medicine.